how well can LDN help to slow down pancreatic cancer growth? Now we know some pancreatic cysts will become cancer in 10 to 20 years. Can LDN help to slow down this process? Well, there's certainly a lot of evidence on pancreatic cancer with LDN. Dr. Berkson, I think, is who I often refer patients to. I think he's in the States, isn't he?
Yeah, Berkson.
Yeah. Now, he works a lot with LDN with alpha lipoic acid, so there will be plenty of research on that. But yeah, certainly there is quite a lot of evidence to show that the progression of pancreatic cancer in some patients can be slowed down by the use of LDN.
And don't forget to take a look at what's actually going in the biome, whether or not someone has spirochetes, and that's usually an oral bacterial dysbiosis. So you've got to be careful with that, and you can't avoid addressing dietary issues.
Would you suggest anything like mebendazole or doxycycline for that in alternate doses?
So really low dose use of doxycycline has been studied with pancreatic cancer. Anywhere from 10 to 20 milligrams has been used, but doxycycline is just rough on the gut, right? It's just not easy to take. A lot of people can't do it, but it has been used, and it's been used successful. But if you have the gift of knowing that there's a cyst, and you have the gift of time to make an impact on that, pancreatic cancer is it's on the rise, at least in my neck of the woods. I mean, I'm seeing 40, 45-year-old women being diagnosed and passing away way too young. And if you have the gift of knowing what it is and the opportunity to actually take action, why wouldn't you?
Yeah.
This one was asked of me, what do you consider a biologic? So a biologic is a classification of medications that work on very specific pathways. So some of the biologics that are now out there are like Humira and Ozempic. Help me out, Sam.
Oh, golly.
Yeah.
Any of those injectable autoimmune drugs are going to be what we're talking about when we say biologic. Usually they end in like the MAB on the end. So tons.
And immunoglobulin sort of therapy.
Yes. Yes.
Yeah.
And the generic names are really hard to pronounce because there's a whole lot of consonants, and they use X and M and A and B, and they're just mouthfuls of words, but they're usually injectable, and they're usually used once a week. So Copaxone was a biologic. It was one of the first MS drugs, right? And it was used once a week. But there have been several others, and they're usually for autoimmune type issues, like psoriasis is considered an autoimmune disease, and multiple sclerosis, even Crohn's and ulcerative colitis. But they're starting to use some of the like semaglutide for diabetes, because perhaps there is an autoimmune issue associated with diabetes. It's a very, very good possibility. I hope that